So I was very fortunate to be able to chair this session, and we had 5 abstracts, and I'll just briefly talk about each of them and what my take-home message was from them. So the first abstract was Dr. Michael Desborough, and that was a study looking at giving Desmopressin to patients having procedures on ITU. So the patients were blinded to receive Desmopressin or placebo at the time of going through what was mostly minor procedures like line insertions. And essentially this was quite a small study with difficult to sort of see any significant change in outcomes at this level. But I think what it really demonstrated was feasibility of doing a bigger trial to look at this to see if this is a strategy that might help in terms of blood product use in the future. So interesting sort of preliminary data and food for thought about how we can change transfusion practice in ITU patients in the years ahead. We then moved on to looking at some data from the UK TTP registry, looking at relapse data and treatments for relapse. That was from Dr. Andrew Doyle. And that was interesting, and I think gave us some helpful figures that we can use when we're counselling patients with TTP. So overall, about a third of patients have relapsing disease, and of those patients, the ones who respond to anti-CD20 therapies then maintain that response as they go forward, so we can use it again for subsequent relapses. And I think that'll be really helpful to me when I'm talking to newly diagnosed patients about how we'll monitor them and what the years ahead will hold. So very helpful additional information. The third abstract was from Dr. Philippa Stimpson, who's actually an internal medicine trainee and did fantastically to present at this kind of session. And her abstract was about long-term anticoagulation in men over 50 and whether the DASH score is helpful. And essentially what she found is that even in patients with a low DASH score, there was quite a significant risk of late recurrence of DVT when she looked at a retrospective cohort. So the discussion about that abstract really was that the DASH score in men with an unprovoked event seems to have less of a place than we originally thought. Moving on, we then talked about a really common clinical problem. So patients with lupus anticoagulant who need cardiopulmonary bypass. That was Dr. Christina Crosset-Fambaye. And that was a really helpful overview, I think, for those of us who get calls from cardiac anaesthetists on how we should monitor patients with a lupus anticoagulant who are having bypass. And my take-home message from that really was that if we can access them, monitoring anti-10A levels is a helpful thing to do, or that possibly we may not need to do monitoring and we may need to just go for an approach where we accept these patients are high risk and use a fixed dose of anticoagulation throughout bypass. And then coming on to the final talk, this was about pharmacokinetic and pharmacodynamic studies in a new agent for ITP called efgartigimod. You'll have to forgive my pronunciation. And that was presented by Dr. Vicky MacDonald, who's chief investigator of the ITP registry. And really what she was showing in this is that we can give this drug subcutaneously, which is obviously very important for patients. And it'll be interesting to see how data on that particular drug develops in terms of being an option for second line or later treatment in ITP. So I think overall we had quite a mix of abstracts presented in this session with lots of areas of hemostasis and thrombosis discussed and some really interesting new findings.